Fellow citizens and residents, on Thursday, 18th February 2021, while making a statement in the House of Assembly, Dr. the Honorable Timothy Harris, Prime Minister and lead head on health matters in CARICOM, informed the Federation that the National Vaccination Plan in response to COVID-19 pandemic will begin rollout on Monday, 22nd February 2021. The Honorable Prime Minister also indicated that the Federation received a donation of the Oxford AstraZeneca vaccine, and we expect to receive additional supplies of over 50,000 doses through our procurement from the COVAX facility and other humanitarian donations. As Minister of Health, I am pleased to follow up on Prime Minister Harris's declaration regarding the rollout of the country's vaccination plan. I am delighted to note that St. Kitts and Nevis continues to be proactive in its efforts to manage COVID-19 as the pandemic wreaks devastating toll on communities globally. I wish to take this opportunity to commend all our citizens and residents who have been complying with the non-pharmaceutical protocols advocated by our healthcare team to combat the virus. Indeed, as a small island developing state, we have been able to protect our citizens and successfully prevent COVID-19 related mortality with our limited tools and resources, an all-of-society approach, and certainly in the true spirit of community, to the extent that St. Kitts and Nevis has become a model country relative to the management of COVID-19. Fellow citizens, I am pleased to state that the vaccine is here and we are ready to roll it out. The fact that there are safe and efficacious vaccines is indeed indicative of one of the greatest public health achievements in human history. As a critical health resource to protect the vulnerable, save lives, and reduce the burden of the virus on our health systems. The St. Kitts and Nevis vaccine plan will be rolled out under the auspices of the National Immunization Committee of the Ministry of Health, who relied on the well-established National Vaccine Program with its best practice measures, relevant input from regional and international partners such as PAHO, WHO, and the Strategic Advisory Group of Experts on Immunization. The plan consists of the following key elements: a governance structure for planning and coordination, a vaccine delivery infrastructure and supply chain, an evidence-based approach to decision-making, a system for ethical and equitable access to vaccination, an appropriate legal and regulatory framework for vaccine deployment, a robust education and communication strategy, a mechanism for capturing vaccination data in timely manner, a monitoring mechanism for adverse reaction and effects, and post-marketing studies on effectiveness and impact. The plan will be executed utilizing a three-phased approach, and the main goals are to 1. Mitigate against death and serious disease, 2. Promote maximal functioning of society, and 3. Reduce the burden of COVID-19 on vulnerable persons. The overall aim of our country's plan is to ultimately access adequate amounts of COVID-19 vaccines to consequently vaccinate at least 70% of our population to achieve an appropriate herd immunity threshold. This media presentation, therefore, is a follow-up to the Prime Minister's announcement as part of the robust COVID-19 vaccine awareness campaign by the Ministry of Health to provide more specific information regarding the national rollout of the vaccine commencing Monday, 22nd February 2021. The key points of the country's vaccination implementation plan are as follows. The vaccine will be administered to persons 18 to 80 years of age. Persons over 80 years of age will be required to be evaluated by their physicians prior to receiving the vaccine. Vaccine information brochures can be found on the covid.gov.kn website or on the social media pages of both St. Kitts and Nevis health promotion units. Persons can also collect brochures at the community health centers and the administrative office of the Ministry of Health at Blaydon's Development. Administration of the vaccine will be based on an appointment system. Persons who are interested in being vaccinated may call the health hotline 311 or visit the nearest health center to make an appointment. Once the first dose of the vaccine is given, persons will be issued with a COVID-19 vaccination record card and an appointment to return in 10 weeks for the second dose of the vaccine. Additional information regarding the vaccines and the vaccination process will be disseminated to the public via various modes of communication as part of the ministry's awareness campaign. The following health centers will be used for the initial rollout of the phase 1 of the vaccine: on St. Kitts, Newtown, Basse-Terre, Sandy Point, and Tabernacle Health Centers, and on Nevis, Charlestown, Gingerland, and Combermere Health Centers. During the subsequent phases, all 11 community health centers in St. Kitts and 6 in Nevis will be utilized for vaccination. Please take note that the following categories of personnel who fall into the first phase and who will be vaccinated during this first phase starting Monday, 22nd February 2021 are as follows: healthcare workers, those who work in high to very high risks, such as specialists, internists, doctors and nurses on the COVID-19 ward, operating theater, intensive care unit, accident and emergency, COVID-19 testers, health center nurses, managers and assistants, and emergency medical services personnel. Older adults ages 60 to 79 years with chronic diseases and 2 or more comorbidities. Border protection staff along the corridor of containment, which includes port health, immigration, customs, ground transportation, including taxi drivers, hotel workers at front desks, security, and lobby. Please note that we are also going to reserve an emergency amount of vaccine just in the event that there may be an outbreak or response mitigation required. To initiate our vaccination rollout and awareness campaign, the general public should kindly note that at 1 p.m. on Monday, 22nd February, the Ministry of Health will launch the national rollout of its AstraZeneca Oxford vaccine at the Newtown Health Center, Ponds Pasture, St. Kitts. During the launch, persons representing a cross-section of Stage 1, including members of Parliament, will be inoculated with the vaccine. Everyone is asked to tune in or view the launch, which will be aired and televised via various media houses in St. Kitts and Nevis. I urge you, citizens, to come forward and demonstrate your love of self and country and facilitate the return to a sense and state of normalcy by being vaccinated. I submit this is the best and safest way to combat the virus and mitigate against the dire consequences and impact of its transmission. Our individual and collective action would certainly alleviate the pressure exerted on our healthcare and frontline workers relative to the virus. Finally, as we embark on our vaccination rollout, I ask you not to be complacent, but to maintain continued vigilance and adherence to the public health measures we have adopted thus far in our quest for a stronger and more resilient and safer health sector, and by extension, a safer Federation of St. Kitts and Nevis. Thank you, and may God continue to bless us all.